This is Dr. Ben Pearl with Fit for You. So today we're talking healthcare and some of the misconceptions about healthcare and how it actually works. So I've got Craig Thompson. He's been a Medicare advocacy patient. So you're going to tell me about what I like to deem Medicare disadvantage and some of the things that most people don't know about healthcare.
That's right. So Dr. Pearl, recently we found that the CEOs of the publicly traded health insurance companies were complaining on Wall Street conference calls that they're going to prioritize margins over members, which is code for lowering reimbursement rates, reducing covered services, procedures, and products. And that's also divesting themselves of a high utilization, chronically sick population that they want to move into original Medicare.
You had a chance to serve on some panels. What were some of the things that happened that you learned with your other members?
So what we found is that with Medicaid in particular, but all of the health insurance industry, that there were stakeholders that were designed to represent all the various groups, whether it's providers, payers, here we are in a hospital, and then we've got the health insurance industry, and then we had state-based officials, government officials, masters in public health, MBAs, masters in public policy, and then we had, of course, naturally a few MDs. What we found is through that stakeholder engagement, there was a constant back and forth and sometimes conflict and sometimes concessions and agreement. But rarely could you get anybody to agree completely on one point, particularly in regards to reimbursement rates, what's a covered procedure, and how much all these co-pays and deductibles and premiums should be.